All attendees are in listen-only mode.
Hello, my name is Mary Bennett, and I'm a community coach with the County Health Rankings and Roadmaps. Welcome to our webinar today entitled Student Mobility: What Happens When Students Frequently Change Schools. Today I'm joined by my colleague and fellow coach, Jan O'Neill.
Hi everybody, good to be here.
As we go through this presentation, Jan will be sending out links via the chat box, and she'll be answering questions, as well as another colleague and fellow coach, Attica Scott. So now I'd like to take just a second to briefly introduce our wonderful guests. We have Rob Potlager, the National Director of the Siemer Institute, who I have had the privilege of working with, and I'm excited that Rob is joining us today to share his knowledge, experience, and work, and fabulous work of his network.
Hello, everybody.
And also we have Kathryn Koch, Executive Director of the La Crosse Medical Health Science Consortium, who I also had the privilege to work with as La Crosse was selected as an Action Awards coaching team for their exceptional work in La Crosse, and she'll be sharing their experience with addressing student mobility in La Crosse, Wisconsin.
Thanks for having me, Mary.
So we will hear more from our guests later, but right now I'd like to welcome each of you participating in this webinar. So the County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We also like to recognize that this program is the result of the contribution of many colleagues and partners here in Wisconsin and across the nation. Thanks to their support, we're able to bring this webinar to you today. Now I'm going to turn it over to Jan, who's going to tell you a little bit about how you can interface with our webinar.
Hi everybody. So most people are probably familiar with this, but you'll see a control panel, and on the left side you'll see our slides, and then in the control panel you'll see a little section where you'll find handouts. And we have posted the slides, 2 per page, in a PDF version which you can download and follow along and take notes on. This handout will also be archived with the recording of this webinar, and this webinar is being recorded right now. You'll also see a handout for the chat links that we'll be sending out throughout the webinar, and those chat links will also be a handout archived with the webinar. We really want to encourage you all to post any question along the way that you have for us in the question box, and Attica, as Mary mentioned, will be helping me with those questions. She'll be doing a lot of the answers for those questions, or directing us and letting us know when we get to the Q&A section. We'll know that which questions you would like to have answered there. And if you just want to chat with us privately that way, that's a way to do it as well, is just to talk to us through the question box, and we look forward to hearing and seeing you there. So thank you, Mary. I think that's it.
Thanks so much, Jan. So we'll start with a brief program overview to ground our discussion in County Health Rankings and Roadmaps. This will take about 5 minutes. If you're newer to us, this will give you a high-level overview of our program. To learn more, we encourage you to check out one of our Rankings and Roadmaps webinars. Jan is going to shout out a link to our most recent recording. So we're going to take a look at some tools and resources from the website that can help you address student mobility in your community or other issues that you're addressing. This will be followed by an interview with Rob and Kathryn. We'll then open up for your questions, and Rob and Kathryn will be providing answers as well as others of us here. And then we're going to wrap up with some reflections and resources. And as Jan says, please don't be shy. Feel free to send your questions throughout the webinar, whether they're for us or our guests. So our partner Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles regardless of where they live. In other words, building a culture of health requires everyone in a community, especially those most affected by poor health outcomes, to have equal opportunity to enjoy good health. This is really the heart of our work. Oops. So CHR&R is rooted in the theory that health is the sum of the many parts. I often talk about it as being pieces of a puzzle to see a full view. Some of you may have seen this image, and for others it may be new. This image shows our approach to health and the foundation of CHR&R. So as you can see here, policies and programs can and do influence health factors, which in turn impact health outcomes. And multiple factors impact how well and how long we live. Things like how we commute to work, access to parks, the quality of our schools, access to care, and diet and exercise are just some of the factors that influence our health outcomes. In addition, access to healthy foods and opportunities to be active. How do you see yourself fitting into this model? This image is our Take Action cycle. It shows that in order to address health effectively, multiple stakeholders have to be included in the conversation. You'll also notice the action steps around the cycle that start from the right, span from assessing needs and resources, all the way over to evaluation. Work together and communicate encompass the entire cycle because those action steps occur concurrently as you are completing with the others. When on the website, you'll notice that these action steps are hyperlinked. So this is where you can access the hundreds of practical tools and resources that will support you in moving forward in your work. Now focusing on the data side, which many people are more aware of our data work. And most of you know that we rank the health of nearly every county in the nation annually. The county health rankings illustrate what we know when it comes to what is making people sick or healthy. Your snapshot provides data to help understand what is influencing the current and future health of your residents. There are measures related to student mobility, which can assist you to build your case about academic achievement challenges, disruptions that result in frequent moves, and the need to increase housing stability to reduce the impact on students, families, schools, and the community. In addition, check out your state page for additional data to see if there's more data available at demographic and sub-county levels. So on the solution side of our work, What Works for Health is a resource that provides evidence-informed strategies that can improve health. It serves as a starting point to help communities identify policies, programs, and system changes to address their local priorities. It includes almost 400 strategies to date. So you'll find that there's an evidence rating, which conveys the likelihood strategies will work based on best available evidence, a short literature summary that highlights who a strategy can benefit, what it can do, and as we have it, information about cost. Also includes a disparity ratings to help community use an equity lens as they explore strategies. And lastly, implementation resources to move from idea to action. And here you see a list of strategies you can find in what works for health. So while searching for, let's say, academic achievement and disrupted relationships that result from frequent moves, or increasing housing stability to reduce frequent moves. So you can see here, school community liaison comes up, and it provides information about social services and healthcare supports to low-income or at-risk public school students or other families. You also see community schools, which would come up, combining academics, physical and mental health, social services, and resources for students and family, as well as service-enriched housing, talking about providing permanent basic rental housing with social services available. And lastly, rapid rehousing programs, moving families into permanent housing. I encourage you to check out all these resources, which truly can support your work to make your community healthier. So now, turning to our guests, I'd like to introduce to you Robert Potlager, as I said before, and he's the National Director of the Siemer Institute. Rob's responsibility is to direct the development and implementation of all aspects of the Siemer Institute, both long-term and strategic, as well as day-to-day operations of a $20 million annual budget. He's responsible for overall accountability of the Institute, including all fiscal and programmatic oversight, management, and reporting. The Siemer Institute is a national integrated comprehensive model to prevent family homelessness and reduce student instability. He'll be telling you more about their work in just a few minutes. I'll go ahead and also introduce Kathryn Koch, who is Executive Director of the La Crosse Medical Health Consortium, a partnership of 2 major medical centers, 3 schools of higher education, a school district, a county health department, and a county health department in La Crosse, Wisconsin. The consortium is dedicated to fostering collaboration for healthier communities by improving population health and strengthening the health workforce. So we're first going to turn to a conversation with Rob. So Rob, could you tell us really, just to start out, what really is student mobility and why is it important?
Well, Mary, thank you for having me on the call today. I'm excited to talk about this. As you referenced, the Siemer Institute is focused on this work on a national basis. But before we get into that, student mobility is one of those most detrimental factors that are affecting students and their ability to succeed in the classroom. And unfortunately, this happens outside of the school walls. Some of the reasons are when parents or guardians are struggling to make ends meet, financially, or maybe they're dealing with abusive or unhealthy relationships or shifting of their locations for work. The children involved are usually often forced to move from one school to the next. The research that we've seen on housing and school mobility indicates that students who move frequently have a lower average academic success. And students changing classrooms and schools several times throughout the year have an actual negative impact on their learning. Some of the research shows if a child moves 3 times within one academic year, they actually lose an entire year of schooling. Some of the challenges with this, as you can imagine, is we don't have a standard curriculum that is taught within a school district and in a lot of cases between school districts. So it's really tough knowing where a student's education level is and what topics they're currently learning when they do move. And more that a student moves, it's hard for the teacher to catch them up. And then there's also that social impact, you know, losing your friends when you go to a new school, saying goodbye to other ones. You know, I think that's probably the main thing, as you asked, why is it important for us? And I think the social impact, loss of friends, not wanting to make new friends because they think they're going to move anyway. We've also seen an increase of absenteeism when students move frequently throughout the year and in their education levels.
So thanks, Rob. And as you talk about this, it seems mobility is actually caused by something bigger and impacts the whole family, the school, and the community. Can you talk more about this in terms of the cause?
Yeah, there's really a lot of that is due to lack of resources. Usually it's because of families, lack of resources when it comes to stable housing, low wages, an unexpected loss of income or increased expenses. In a lot of cases, that could be medical bills. In most of the communities that we work with, you can find less expensive rent, for example, so for, say, maybe 30 or 90 days. So some families just pick up and move, thinking they're going to save money without realizing that negative impact that it's having on their school-age children.
So, yeah, it's people in a tough situation. And what do you see as some of the national trends that are impacting these mobility rates?
I think one of the things, especially over the past year and a half to 2 years, we are seeing across the country an increase in rents, which obviously is then causing families to spend a larger portion of their income for that rent. Also, we're seeing that there is a lack of transportation. It could also be no transportation. A lot of families, in some cases, the adults have to use bus lines. And if they're not centrally located and easy access to that, they could take 2 or 3 or 4 buses just to get to work. So that could really add to it. You know, on top of that is their work may not be flexible. So you take poor transportation or minimal transportation along with work schedules that are not flexible, and then the adults in the family are really limited. One of the other things that we've seen, and it's probably a buzzword over the past couple of years, is really the benefits cliff. And so just in short, what that really means is if individuals are receiving assistance from the government, and say, for example, we could talk about assistance for child care. If they received an increase in their wages of, say, 25 cents, multiply that out for the number of hours they would work for the month, that could actually throw them out of eligibility for daycare. So what we're seeing is that they fall off the cliff, meaning they make too much money to receive those benefits, but it's not enough to make up for the benefits.
Thanks, Rob. And, you know, as you're saying, you know, back to the vision of Robert Wood Johnson of health for all and the conditions for people to have health for all, we're really a far cry from that. So now that we've shared some background information about student mobility in general, can you tell our audience about what is the Siemer Institute doing about this, and how did it get started?
Thank you. This is actually one of the best things that I like talking about. It's my day-to-day work. The Siemer Institute was actually established by Al and Barbara Siemer back in 2011. We had 10 original cities that were part of this, 6 in Florida and 4 in Ohio. Since then, we've actually grown to 53 cities throughout the country, and we are in most of the largest cities, as you can see on the map there. The Siemer Institute focuses on homelessness prevention and actually reducing school instability for families with school-age children. So our goal and emphasis is to improve long-term housing and economic stability for the families of at risk of homelessness with the ultimate goal of keeping their kids in school. And we do and focus on homelessness prevention because it's a lot cheaper to get to those families before they get into the system to help them become stable.
Thanks, Rob. And could you talk more about what's the importance in terms of focusing on early intervention and homelessness?
So what we have found, and I imagine a lot of people on the phone today would be able to attest to this, we found it's better to find the families before they're at risk of their eviction or already homeless for several reasons. First of all, families that are in crisis, it's really hard for them to focus on long-term stability. They really try to resolve whatever that immediate crisis is that's right in front of them. When families are homeless or on the cusp of homelessness, the financial requirements to keep them stable actually can end up being too large. They may have some rent in arrears, or they might be behind on some other bills, so that debt can really just pile up. And we've also seen that it's more expensive, as I imagine a lot would agree to, it's much more expensive to keep a family in shelter than to keep them on their own. And it's also very traumatic. So you can imagine for the adults as well as the children to lose a home, how traumatic that could be. One of the things, though, that we have found in order for all of this to work from a prevention model is getting the referral to help these families and getting them at the right time. So it's kind of right before they actually need that assistance.
And I know that with this work, the excellent work you're doing, and I just so appreciate that there's 53 of these programs across the nation. And just as in our work, and maybe many people on the phone also, often it's, we don't work alone and in isolation. So can you talk about who are your partners in this work and what is the partnership structure?
Sure, thank you. So this is one of the things that we have found to be most successful since we launched, and it was the vision of Al and Barbara Siemer. The Siemer Family Foundation, which is based in Columbus, Ohio, actually funds this work through the United Way system overall. So United Way here in Columbus, where I reside, is our fiscal agent. But the Siemer Institute supports, and our funding flow goes through the United Ways across the country for one main reason. We do this because we believe that United Way is well positioned to assemble and align the resources in each community to lead this work. We give the opportunity to each of those communities, to each of the United Ways, to design their program based on their local needs, and I'll talk a little bit more about that in a second. And we also allow the United Way to select their service provider, going back to the fact that we believe that they're the right ones to know those service providers in their community that can actually help with this work.
Excellent. And I really, as I've gotten to know your program and some of the individual states and local communities, I think it's so great that you're really allowing that flexibility for communities to do what is most appropriate, as each community is unique. So can you talk about how this model works on the ground?
Sure, of course, and it's actually one of the things that I think that is most interesting. So from a program design standpoint, our success is really based on intervention, prevention, and education. It is a case management program, and we work intensively with families for at least 3 months at a minimum, and we are coaching our communities to really work with them for 12 to 18 months and to provide that ongoing support. And part of it is because once the relationship is built with the case manager and the families, they really can determine all those additional services that they might need to become successful. The programs are really designed, as I mentioned, to fit the local needs and the resources, and we really encourage innovation as long as the focus is still around housing and school stability. Many of our partners are providing the two-generation services, which is also a new buzzword, but the two-generation is not new. It's been around for a long time. It's really looking to provide services to both the adults and the children to give them the opportunity to thrive. But I really think the case management focus and that length of period that we work with them is really our unique lever for success, because the families have a trusted, committed individual helping them, especially navigate through many different processes and services in order to achieve their goals. I think from a, let me finish a couple other things I forgot. I think a couple other things from a design standpoint, 90% of our partners provide financial coaching, housing coaching, and employment coaching. So again, with a focus on education and housing stability. We also provide flexible cash assistance, as I said, in some cases to try to help rent and arrears. But we also provide assistance for job training and things that might be able to help them improve from a success standpoint.
Excellent. Thank you so much for giving that clear picture of your work and your relationship with partners and how it works on the ground. Could you also talk a little bit about how you're measuring your impact?
So there's a couple things that we are really trying to measure. It's really around housing, income, and then the well-being. So we're really looking from a measurement framework standpoint that we want to be able to target and understand services that are being provided to targeted population. The program outputs are really looking at the number of families that we're serving, and then the program outcomes are really the achievements, and it is around those 4 core outcomes that we briefly spoke about. I think the important thing, as you see on the slide here, is from an increased income standpoint, we really want to be able to track and measure the family's move to a higher level on the income dimension of the Arizona Self-Sufficiency Matrix. We also want to measure the housing stability, making sure the family obtains and or maintains safe and stable housing. We also track the unplanned or disruptive moves, and that would be at the student level. We do know in some cases a move does happen, and it might be something that the family and the case manager wasn't aware of. And if it is a move that occurs quickly and there is not a clear communication with that school, we consider that an unplanned or disruptive move. But what we do focus on is there are the right times that that a move is the appropriate thing for the family, and we track that in a manner of planned and supportive moves, making sure that school A and school B are in communication so that child has a smooth transition from one to the next.
Excellent. And we have questions rolling in. So before we move to the next slide, I'm going to hand it over to Jan and pose a question. They have a question for you, Rob.
Hi, Rob. Actually, it's a question that goes back to your partnerships. Sarah is wondering if you could discuss how United Ways are selected to partner with your institute.
Sure, great, thank you. So I assume that question would probably come up, and to be real honest with you, when we started this in 2011, Al and Barbara Sieber wanted to go to the 50 largest cities in the country. And we kind of went from East Coast to West Coast. And we are in cities that we know it's a strong United Way that would be able to manage and oversee this work, that they have a strong relationship and partnerships within their communities. And I'm proud to say also on the benefit, for the benefit of Al and Barbara, we are also in some cities that they either currently or previously may have done business. So they want to give back through their philanthropy to places that they have lived or have done work previously. So it's a little bit rounded as we reach out to our partner cities.
Excellent. Thank you so much. So speaking of partners, could you share some lessons learned and maybe particularly highlighting lessons learned with some of your partners and partnerships?
You know, I think there are probably three things that I would want to highlight here that we have learned. One of these being within the past 12 months specifically. First is the relationship with landlords can be very helpful. And that might seem like a very easy thing to do, but there are some landlords out there that would rather just churn families as opposed to working with them. Building that relationship, letting the landlord understand the benefit of not evicting if that's the case, of those families, being able to negotiate late fees, payment for rent and arrears, repayments. Landlords that are more willing to work with the family if they know they have a trusted organization. So in some cases, they may not want to take a risk on a family, but if they have that service provider and the United Way's backing, they might be more willing to do that. Also, building relationships with the schools. I talked earlier about trying to get the referral and figuring out when that referral is most timely. We have found that building relationships with the schools sometimes and mostly are at the principal and or counselor or nurse level within the school, just because they are in the day-to-day interactions with students and probably hear more what's going on. They also have that deeper relationship. But I do have to compliment one of our programs in Phoenix, Arizona. It's actually in Avondale, Arizona, and they have support at the superintendent level. And when I was there, fortunately, to visit them last year, she attests to this work and says if a student needs transportation to keep them in their classroom during the school, she will pay for it out of her budget because she realizes the benefit of that. I think the last one is finding the right referral partner. You know, some of that comes from the schools, some of it may come from community centers or organizations, and some can come from service providers. So those are probably the three big lessons learned that we've seen over the past 6 years.
Thanks so much, Rob. Really, really appreciate it. And we'll be getting back to you for the full question and answer. So now we're going to turn to our other guest, Kathryn Koch. And just a reminder, as I said before, Kathryn is Executive Director of the La Crosse Medical Health Science Consortium. And I can vouch for excellent work and the work of the community in terms of their fostering of collaboration to improve the health in their community. So Kathryn, can you please start off by telling our audience about how did you come to focus on student mobility in La Crosse?
Thank you, Mary. As you mentioned before, we were invited to apply for an action award in 2015, and they asked us to address a community or a neighborhood issue. So we started by bringing together a team of people in the community that reached beyond our usual public health and education partners. Our team included representatives from a local neighborhood association, a financial counseling service that serves all income levels, our local extension office, a healthcare organization, and a new collaboration in the community called the La Crosse Area Family Collaborative, which places social workers directly into 2 of our neighborhoods to address the residents' needs there. We selected one of those 2 neighborhoods to focus on, partly because our partners knew the needs of that community, but more specifically because, unlike some of the other neighborhoods in La Crosse, there are no large institutions or businesses located there that could act as an anchor institution for neighborhood residents. We started by conducting interviews with people living and working in the neighborhood, such as business owners, neighborhood leaders, school personnel, one of the leading landlords in the area, and the local Boys and Girls Club director, to find out what the issues were that they were seeing in the neighborhood. That's when we first started to hear about the problems arising from student mobility. Kids whose families were moving frequently were facing academic and behavioral problems that were not being resolved. So we decided to focus our efforts looking at mobility in the neighborhood's elementary school, where 80% of the students were eligible for free or reduced lunch, and where the student mobility rate was more than 36%.
Thank you, Kathryn. And can you talk more about how'd you then go about, what were your next steps in addressing the issue?
Well, we started by surveying the families at the school, both at a school function and then again at a community meal. And we asked them about their moving history and their reasons for moving, but we also asked about their perceptions about where they lived with regard to safety and the impacts that it had on their children. We also held a focus group of teachers from the elementary school and learned a lot more about how high mobility has been affecting behavior and children in the classroom. Mary, then you connected us with Rob at the Siemer Institute, and as well as one of their funded programs here in Wisconsin. And from them, we really learned 2 very important lessons. One of those is that the families needed to be treated as a unit. And Rob mentioned this before as being the 2-generation services. As we heard from the teachers, behavioral problems in the classroom often stem from other issues at home, and often by addressing those needs of other family members, we can alleviate stresses on the child. The other lesson that we learned is that there really isn't one common solution for student mobility. Every case is based on a unique combination of circumstances that culminate in the need for a family to change their residence. And often there are many issues that are acting on many different members of the family. This was especially evident on the surveys that we did with families, which were showing really no patterns that we could detect as to what causes a family to move. What we were finding instead was that every family is different.
Yeah, and I really want to applaud you because I know that you really went to the community and engaged the families, the teachers in the conversation to really better understand what was their experience and the impact. So can you talk about what intervention you chose to address student mobility? I'm sorry I got a little behind on the slides, but now we're at the interventions.
Sure. Well, we knew that school and child care personnel are especially well positioned to find out when a child's family is involved in a move. So if they could help identify children that are in this situation either before or after the move, they could potentially refer that child's family for services. And since the Family Collaborative was set up to do exactly that, we saw that as an opportunity to get involved. What we did is we looked at mobility rates in our elementary schools and found that 2 of the 3 highest mobility rates were in neighborhoods that were served by the Family Collaborative. This 3rd school was in a different part of town, but it is also the school that is designated to accept students who are living with homelessness, and they are also therefore served by the Family Collaborative. One of these schools too was in the neighborhood that we had been focusing on. So we decided to run a pilot program on these 3 elementary schools with the high mobility rates to see if we could make a difference in their mobility rates by working directly with the families that were involved. We created an MOU between the school district, the Family Collaborative, and the Parenting Place, which is a nonprofit in La Crosse that provides many different services related to parenting and childcare. The MOU stated that any children who were identified as being on the verge of a move or just completing a move would have their family automatically referred to the social workers at the Family Collaborative. The collaborative social workers could then contact the family and determine if there was a need for any services that could either prevent the move if it was disruptive or could alleviate the impact of a move that was already complete. As Rob mentioned in his talk, we know that some moves are very necessary and for good reasons, such as a parent getting a better job. So sometimes there were no services needed at all. We had learned from our focus groups with the teachers that most of the common issues leading to mobility were transportation and housing needs. So we set up a fund of $10,000 from our Action Award at the Family Collaborative for them to tap into to help mobile families with these kinds of expenses and hopefully avoid the need for the kids to change schools. The MOU allowed families to be referred for financial counseling as well if that was needed, and that would hopefully help reduce the need for further financial assistance in the future. The pilot project ran for the 2016 and 17 school year, and in that time the Family Collaborative helped out 10 unique families and used just over $7,000 from the fund to address 11 housing concerns and 6 transportation issues. We're still working with the school district to determine whether this had a measurable effect on mobility in these 3 schools. Some of the data is still coming in, so we're not quite done with our analysis yet. And we don't know if the effect of keeping children from 10 families in their home schools is going to show up in school-wide data. But it is important to note that for every child who stays in their school of origin, the positive impact on their mobility rates is potentially twofold. So once at the school of origin and then again at the new school.
Thanks so much. And as you said, I was part of this effort and really saw how well you use both the data, the community, the people who you were, who the service was for, everyone involved in really moving this forward and seeing how you can have some true impact. So building on this effort right now, can you talk about what your next steps are?
Sure. So having completed our pilot year, we know that the fund and referral process was able to help these 10 families, but what we really need to do is to look at the bigger picture of what impact we had on mobility specifically. So our next steps will be to review the school mobility data as it becomes available for the past year and to use those outcomes to decide what further investment is needed to prevent excessive mobility in all of our schools. This is something actually that I know you're going to mention at the end of our session about a discussion we'll have next week with more members of the team. Working with the Family Collaborative then, we also want to look more closely at the specific needs of the individual families that they worked with so that we can see a little more qualitatively what the impact was of the referral and of the funding. There may be situations where funding wasn't used and we'd like to find out a little bit more about what some of those specific situations were that were helpful in the neighborhoods. This is also going to help us tailor the use of funds in the future so that we can have the most impact. And we'll also need to meet with our MOU partners to determine how well the referral process worked and whether there need to be any changes or expansions to that agreement. There may be other agencies that we'd like to bring in or to talk a little bit more about how identifications are made of kids who are about to move. And finally, we want to weigh all of this against the impact that we have had on mobility at these schools, but also our potential to increase that impact in other schools and in these schools, and whether we need to work with area funders to develop more permanent funding so it can continue. When we first started this project, the schools were already beginning to look at mobility as an issue affecting student performance and behavior. So we know there's support in the community for continuing to find solutions to excessive mobility. We're also part of a larger collaboration called Rebuilding for Learning that brings together many of our existing partners from this project, but also the city and county government to address some of the leading barriers to learning that kids face in school, such as homelessness and hunger. Through that partnership, we'll continue to make sure that mobility is part of the community's conversations and that we are working together as partners to find ways to reduce it.
Well, thank you so much, Kathryn. And all that you've shared in the process, I think, will be helpful for other communities to think about what they could do. So now I'm going to turn this over to Jan because we do have lots of questions coming in via the chat box, and then I'll come back for just a final wrap-up. Jan.
Great. Well, thanks so much again, Kathryn and Rob. This is great. Yeah, we have a number of questions. Let me just follow up with Kathryn because you just were the second speaker here, Kathryn. Roger is wondering how you measured mobility rates. Can you speak to that?
Sure, and I believe that Rob mentioned that there's not a lot of consistency with how mobility rates are measured from one school system to the next, so that is an issue, and I knew someone would ask that, so I made sure I figured that out. In the La Crosse School District, they were measuring mobility rates as the number of new entries after the beginning of the school year and the number of withdrawals after the beginning of the school year added together, divided by the population of kids in the school that year. And so that's how those percentages are figured.
That's great. And Rob, if you have anything you want to add to that, feel free.
No, I don't necessarily that I do anything to add, but that is one of the challenges is it's not consistent across the country. So what I ask my teams when they're actually looking at it is just to make it consistent throughout the year and throughout the school district.
And also we sent out a chat link about Kids Count Data Center, which is published by Annie Casey. There might be some helpful data there on student mobility in your area for the audience here. But yeah, it's a tricky one, but being consistent is really important, is what I'm hearing you say. So a second question, this is from Jennifer, Kathryn. What data sharing concerns were there involved in the MOU, and how did the referrals and information sharing, how did that work across sectors?
We made sure that we included all of the people who were going to be part of the MOU from the very beginning of the project. So the Parenting Place, the Family Collaborative, which originally grew out of our Crosse County Human Services program, and the school district were all at the table along the whole process. And so we had everyone's agreement up front that this kind of a referral could be made, and how that would play out in terms of you know, what situations they were identifying. So I think we're going to get more into some of the specifics of any hurdles they ran into during the referral process during this pilot year when we start working more closely with the individual data. But basically it was involving everybody at the beginning and making sure that was something that they were able and willing to do. I know that the school district was in communication with the leadership at the 3 schools that we worked with, the teachers and the counselors, to make sure that they understood the process and what might be happening. They also have connections between the Family Collaborative and the school district, and that's something that's kind of built in as part of the relationship that allowed the Family Collaborative to come about in the first place. Mary, we can't hear you.
Sorry, I was on mute. Another question that has come in is, and either one of you could perhaps answer this, do you have any information about how changing schools might affect food insecurity for children and families?
Kathryn, do you specifically, because I don't know that I could answer that.
We didn't look at it specifically in terms of cause and effect, but I know that one of the reasons we chose the school that we did work with was because they had a very high free and reduced lunch rate. And so I know that food insecurity very often is connected with many of the other challenges that lead to the referrals that we were working with. But I'm not familiar specifically with research that's connecting the two, but I would imagine that they would be.
Right. Yeah, all this data is kind of hard to get. So again, I would also encourage people to take a look at the kids count data and see if there's some possibilities there. But another question, how to reconnect students to new schools with minimal loss of ground. That's sort of getting into some of the nuts and bolts. I don't know if that's something you could address, Kathryn, or maybe it can be brought up in the discussion group next week. What do you think?
Could you repeat that a little for me?
How to reconnect students to new school with a minimal loss of ground. Maybe either one of you might be able to address that.
That was something that we had talked about early on when we first started discussing mobility and talking with the teachers. And I think a lot of that comes into how each school district is run. There's a big difference between a student moving from one school to another within a school district than there is from moving to another school district or to another state or coming in from another state. And there's a lot of disruption when students come in from other areas where they don't have records coming with them. I think Rob referred to that as some of the problems that come with not knowing where a child is in their academic development when they arrive at a new school and the time that it takes to get caught up with that information. So I know that there have been sort of some informal efforts to try to alleviate some of the effects of a move by connecting with families when they first join a school and come into a neighborhood, but that's something that we've actually talked about as being a possible solution, not even necessarily at the school level, but within the neighborhoods. Is there a way to welcome new neighbors into an area who have come in during the middle of the school year? But Rob, I bet you've come across a lot more of that too.
You know, one of the things that comes to mind is our program in Toledo, as well as part of our program here in Columbus, Ohio. It's a community center environment. And so to your point, Kathryn, as individuals are moving into a certain point or to a certain part of town, that community service center has a lot of different services that are available. And so by being able to bring those students in to maybe the Boys and Girls Club or some different after-school things, kind of really helps get them engaged, helps them from a social standpoint. But we really do rely on that transfer, if you would, from school A to B, that conversation with the guidance counselor in each of those places, or even the teachers to try to help with that. But not forgetting that everybody's busy, and so the teachers have their plate full. But we found those things to be very successful and help the student as they move.
Great, thanks so much. So how about just one more question, this one for you, Rob. How can someone connect to one of your programs?
That's actually a great question. So anybody can go out to siemerinstitute.org, and there is a tab on the website for partner communities. If you hover over any of the dots based on what city you're looking at, it'll give you the contact information to our, what I call program manager at the city level. So for example, if you hover over Atlanta, you will get the phone number and email for Amy Barrow, who runs our program there. And then she would connect you directly with the service provider that oversees their work.
Great, thank you. And we also chatted that out on the links there so people can see. Let's see, I just want to make sure we got all the questions. I think next week, Kathryn, you put a plug in. Thank you for doing that. But Mary will talk a little bit about the discussion group that we're going to have next week, so more opportunity to get into more in-depth conversation about this. Thank you both so much. And I'm going to turn this back to Mary.
Thanks, Jan, and of course, thanks so much, Rob and Kathryn, for sharing your work and doing your work that is helping so many families and children. To conclude this webinar, we want to make sure that you know that County Health Rankings and Roadmaps employs 11 community coaches, such as myself, Jan, and Attica, who's right in this case being in background, chatting out, helping to chat out links. And we're strategically placed across the country, from California to Colorado, Pennsylvania to Florida. And coaches can provide you with tangible support to advance health in your community. So you can easily reach out to community coaches by clicking on the Get Help button, as you see here on our website. And it's throughout the website, but particularly in the Action Center. And as Kathryn and Jan both referred to, we have a new opportunity to tell you about on Tuesday, July 25th at 3 o'clock Eastern, 2 Central. We will offer a post-webinar discussion group, which is a chance to really dialogue more with colleagues across the nation about what you heard today and about increasing student stability or academic success for children, and addressing homelessness. So note that this conversation is different than our webinar because it will be facilitated and interactive discussion where you can share what you're doing locally as well as ask questions of other participants. So please plan to attend. Registration is limited. It will be video conference video conferencing will be used and is highly recommended so that you can see people's faces as they talk. And so sign up early because of this limited capacity. And we will also want to know what question you'd like to dive into. And the earlier we know what you want to know, the better we'll be prepared to facilitate a meaningful conversation. So reflect on these questions in advance and be prepared for the discussion. We'll encourage you to submit questions, like I said, topics you'd like to discuss. And as I mentioned, this will be facilitated conversation with our wonderful partner, Joanne Lee, with Active Living by Design. And I know that also Jan's going to be chatting out this information in the chat links. So lastly, please do stay connected with us via social media, Twitter, Facebook, and don't miss seeing our latest news by signing up for our newsletter. You can get lots of great information. And I again thank you to everyone on the call, and especially to our really special guests. And Kathryn or Rob, any last comments that you'd like to make?
I'm just looking forward to the discussion next week, so that should be a good conversation to start with.
And from my standpoint, Mary, was very excited to get the call when you set this up. So I appreciate the opportunity to talk about this work, because it is critical for children's education and well-being. So thank you.
Yeah, thank you for having us.
All right. Well, on that note, we'll close for today, and stay well. Thanks so much for everyone's work to improve health in your communities. And on that, I'll close the webinar. Thank you.